This is my city, and I am your host, Blake Carter. Today we are in Yorkville. We're right on Hazelton at Visage Clinic, and the wonderful Dr. Marc has invited us to check out your brand new setup here. So thank you for having us.
Thank you.
And how long has Visage Clinic been here in Hazelton?
We moved here in November, so 4 months ago. This was a 4-year project that we start from scratch, and this was all done with the goal of customer service. We are quite proud to have won 4 years in a row the Top Choice Award for customer service. So this is all here, something that we've built that looks calm, serene, professional, inviting, and safety was always at the top of our mind.
So you might be wanting to come see Dr. Marc for cosmetic procedures. They also have medical spa. There are lots of different things which we are going to get into, and I also want to show you the rest of the clinic. So let's maybe start where you take your patients, your clients for their consultation.
Perfect, come along. I bring all my new patients in my office. I want them to kind of see where I do my work. I will meet you, I will go over your questionnaires, so it's important for us to know your medical history, your allergies, your medications. Once I'm done with the consultation, I like to take you in my examination room, especially if it's for body surgery, breast, tummy tuck, legs, calves. So I will do my physical examination, take my measurements there, and then I have a photo room that I will take you into, take my photos, and then you can get changed, and then you meet my other staff.
And you're gonna have those beautiful before and after. I wanna actually have you assess some things on my face, but first I see all of these different implants in front of me, and I'm kind of curious about these.
Yes. Now, I am a facelift type of surgeon. This is what I train into. I went and spent some time in Paris and Los Angeles. This is what Visage means. Visage means face.
Is your specialty.
Face, neck, eyelids, forehead lift. And I will really take passion about it. But one other niche I developed over the last 10, 12 years is body implants. Body implant is not something we learn in plastic surgery school except for breasts. So this is something I went and learned beyond my training to do. And those includes, for example, here I have a pectoral implants, 2 different shapes, 2 different models, so to speak.
So who's getting pec implants? Like,
you know, we have any kind of guys getting pec implants. We have on one side the bodybuilders who, despite having big pecs, they want bigger. But most of the time, they're guys who, despite all the gym work they do, the pec will not grow. And we've got a few number of people who just want the quick and easy fix.
And this one, you were telling me earlier, is calf implant.
This one is a buttock implant.
Oh, this is the buttock.
Yeah,
oh, sorry, which one? This one's the calf.
The calf implant.
Which, if you've ever watched Entourage, you know that Johnny Bravo wanted to get one of these, and I didn't know this was a real thing, to do a calf implant.
Actually, it's been around for probably 15, 20 years. This started mostly with people with congenital anomaly. So they started doing surgery for reconstructive reasons. And then 10, 15 years ago, this became a cosmetic procedure.
Okay, and I have in my hand then the butt implant, which you were telling me one of the most popular things to get done right now.
It's very popular. And the Kardashian trend.
Nicki Minaj, they started
Nicki Minaj, the Jennifer Lopez before, the Brazilian, so-called Brazilian butt lift, which is really fat grafting to the buttocks. But that has brought a lot of demands for this kind of look. And buttock implant has been around now, I would say probably for 8, 9 years, and more popular today with the internet.
So it's becoming more common and it's safe. And here in Toronto, is this a very popular one?
It's a very popular procedure. And also for guys. You know, we do a few men.
For guys too?
Yeah. I have many patients, often either Caribbean background or Latin background, and it's such a Latin Caribbean look to have what they call a bubble.
Yeah,
buttocks.
The bubble butt.
Yeah.
Love it.
So it's a very popular procedure too. And like breast, we have many sizes and shapes, so we can try to fit the body shape and always aiming for something that's more natural than unnatural.
There's so many things you can do, and I'm sure lots of things you never even thought of. Just to go back to the Kardashians real quick, and then we're gonna go check something else out real quick, but the Kardashian booties, are those natural? Or do you think that they have seen a doctor?
I honestly think they've seen a few doctors or one doctor a few times.
Yeah.
You know, fat grafting is a very popular trend. It's been popular for many years. It was popular in the 90s, mostly for face. And then with the advent of Juvederm and Restylane, the fat grafting to the face went down in popularity until about 6-7 years ago. Fat grafting for the face has come back because people want more natural, more long-lasting results. And with that came the larger volume fat grafting that we now do for buttocks, for hips, we do for breast as well, for augmentation. Now the volume we get with fat grafting is never the same as we can get with an implant. And fat grafting has some physiology to it, which some of it will survive, some will not. So the results are not as predictable as an implant. So it's very common to do a combination of both an implant and fat grafting when we want to reach a higher volume or a more longer lasting result.
Very cool. Okay, you guys are gonna go and check out this place, and when we come back, I have some things going on my face that I would love to ask Dr. Marc about, so we'll be right back to do that.
Aalto is a multi-res development project in Little Portugal, and the idea was to make it really about healthy lifestyle, and that's sort of what we built on from day one. It's 98 suites. We have bachelors up to 3 bedrooms. We have a gym, social room on the penthouse level, as well as a barbecue area and rooftop terrace. It was Toronto's first totally smoke-free multi-residential development. As well, we have the TTC right at the front door. We have car share program here. We have a bike share program. We also offer a Bullfrog, which is clean energy option for the residents. And our target market is really millennials, professionals, as well as any empty nesters that may be selling their home in the area and want to stay within this marketplace. Most of the support on smoke-free came in our sort of our due diligence on what we were going to decide to do. And really the feedback through looking at the marketing and the number of smokers, residents really are looking for a healthier lifestyle and appreciate the smoke-free. It's not the first one that we've done as Real Star. This is about our 4th or 5th one, and the acceptance has been very good. The name Aalto for the property is actually Portuguese for meaning high. So again, this is known as Little Portugal. We're the first multi-res new in this area, and as you can see, pretty much one of the first new buildings in the area. We have the TTC right at the front door, and you can see the views. This is our penthouse level, and you can see the views, and this is also a resident area off of the social room. There'll be 4 barbecues up here for them to use, as well as the social room. This property is really the first sort of new high-rise in the area, and it's gentrifying here, so I would say we're a little bit ahead of the curve. Any marketing we've done to date, we held an open house at a local art gallery. We tried to get all the shops and art galleries involved with us as much as we can, and really tried to make it a community site for everyone.
What are the most popular procedures for the face that people are coming to see you for?
I mean, by far, the number one are injectables.
This is My City, I'm Blake Carter, and we are here at Visage Clinic in Yorkville with Dr. Marc. We are in his office where the consultations happen. I have my mirror out because there are a few things on my whole body that bother me, but I wanted to ask you some questions about my face. And one of the things that, I'm not wearing makeup, I wanted to show you everything that really has bothered me since I was young. Since I was a little kid, people would think my parents weren't giving me enough sleep, or I was eating too much sugar. I get really dark circles, as you can see, under my eyes. And I recently tried to correct that at a different clinic with some filler, and I feel like it has almost made it worse. So can you see that, or is that in my head?
Well, I still see a little bit of residual hollowness and darkness, and that darkness here is caused by three things. One is a lack of volume. We lose a bit of fat as we, you're not old, but as we get
Oh, I'm old.
past the 20s, past the early 20s, we get a bit of loss of fat. So you have darkness from the lack of reflection from the light and from the eyebrows, hiding the sunshine and the light.
So it's my eyebrows' fault.
It's the lack of fat and a little bit of shadow and light issue that we know in photography and art. The other issue is by losing a bit of volume, we get right onto the bone, and the bone layer has blood vessels, veins and reds, so blue and reds, and we see more of that bluish discoloration. Now, there's a third one which is more genetic, and we see this more in the Middle Eastern people, some Asian, some dark Portuguese, dark Italian people. They have a congenital pigmentation in the lid, which is a harder one to correct.
Because my mom is Jamaican, so I am mixed,
Yep.
so I feel like maybe that's the only place the Jamaican showed up, is under my eyes.
But we have good things to help with this. We use fillers all the time. The Restylane, the Juvederm. We can put this extra layer that you've lost over time between the bone and the skin. So we raise the valley up so that the light shines on top
Okay,
of the
so
hill.
I was on the right track.
You are on the right track. There are risks of bruising. Bruising can stay darker for a longer time if some of the iron from the red blood cell can stay a bit longer. So that's why I like to use the cannula system. The cannula technique, I should say, is a hollow tube that does not poke. So it's not sharp like a needle. So we go in and there's less chance of bruising. The swelling is the same. People will get a bit of swelling for 2, 3, 4, 5 days sometime, but the bruising is very rare. The risk of serious complication with the cannula is a lot less as well, but not everybody can use the cannula. It's more technically demanding, so not everybody will offer the cannula system. So it's important to kind of look at the right professional to do your fillers, especially around the eyes.
What are the most popular procedures for the face that people are coming to see you for?
I mean, by far, the number one are injectables. So we talk about Botox, we talk about fillers, Restylane, the Juvederm, the newer Juvederm such as Volbella, Volift, and Voluma. Those are very popular. We have a new one, a new baby in the injectable family called Belcara. Belcara was just recently approved by Health Canada. Belcara is a molecule that was isolated from the liver. It's a chemical that will melt your fat in your gut. It's been isolated, purified, made in a lab by Allergan, the Botox makers. It's a very safe medication, and it's approved for dissolving fat under the chin.
Right here.
The so-called double chin. So it's an injection like Botox. Most people know how Botox works today. So it's done in office, it takes a few minutes, and it will dissolve the fat in 2 to 4 treatments on average. And we like to do this 4 to 6 weeks apart.
Can it work on your belly?
It probably will, but it has not been approved yet by Health Canada. And the way
we need
it works,
to get there. We need to get there. Make it a pill.
Probably over time it will work for little bags under the eyes and for other application. But Health Canada is the safety guardians of Canadians, and they need studies to be done first, risks, complication, and then they approve the treatments.
For people wanting to come see you that maybe aren't ready for needles or surgery, but they just want to freshen up, maybe hide the fact they drank a bottle of red wine last night. What are some things that you guys offer
And you're
here?
talking to a Frenchman, right?
Yeah.
All right. Do you know, it's a very important question, and I tell everybody that your face is the best outfit you can wear. So I think everybody who walks through my clinic should at least meet my medical esthetician, Angelica. She's got gold hands. She knows our products. She knows how to take your skin to the next level. And there's no doubt that medical clinics have access to medical grade products, which Shoppers Drug Store or Holt Renfrew do not have access to. So we truly feel that the skin should be first treated. There's no point in spending hundreds and sometimes thousands of dollars in Botox fillers and sometimes facelifts if the envelope is not nice, clear, clean, and a nice pinkish hue as opposed to a gray, dull look. So I think skincare is important. We offer facials. We offer light peel, so it's not the peel from the old days where it's very impressive and with a lot of downtime, but we also do those stronger peels with laser. So we have profractional, we have laser resurfacing for the bigger problems, the acne scars or the severe wrinkles.
Okay, so I need to see her.
Everyone has skin, so everyone has to look after their skin.
This is my city, and we are here at Visage Clinic in Yorkville with Dr. Marc. I would love to go check out some of the rooms you have. Also upstairs, we are going to show you have a full surgical unit up there.
So Blake, this is our new operating room. This is a brand new, all the equipment is the latest available, so I wanted to create something that's very safe for my patient. Anesthesia machine is brand new. Surgical lights, operating lights. We also had to follow the latest standards by the College of Physicians. So everything is hand welded for infection control, HEPA filters for infection control again. All the corners in the rooms are curved and not corners, again, for infection purposes.
That is very cool. So many details.
All the ventilation system is brand new air from outside going in and back outside. So this is all towards safety and for infection control.
Yeah, it's beautiful and very clean in here.
And large. You know, most surgeons have smaller rooms. We like to have more space, so it's easier for everybody.
So what is over here? What are these beds for?
Here we have the recovery room. So patients have surgery. They are wheeled here into the recovery room. We have nice surgical lights as well if we need to see a dressing or something like that. We have the nursing station here. We have a dirty room where we have our surgical instruments being washed. They're being transferred through a little window into the clean room. They're being sterilized. All our oxygen and medical air supplies are here, and everything is piped. Copper piping like in the fancy hospital, and it's all on the wall. So there are no tanks on the floor. You can see there are no cords on the floor, and those are all, again, having safety in mind. I can safely say this is the safest plastic surgery clinic in Canada. We're the latest as well. Another thing that we've done with this clinic was to bring the customer service to a next level, which is for us very important. We have 2 overnight rooms, which most of our patients are quite happy to stay here overnight. No husbands want to take care of drains and dressing, so patient can stay here overnight with my 2 nurses, and then when they're ready to go home, they can go privately through the back door to the elevator, go back to the parking area, and they can exit the clinic without being seen.
That is very VIP.
You know, every patient want to feel VIP when they come here, and we make our best to make them feel VIP.
So we are just about to wrap up My City. I'm Blake Carter, but before we go, I had to introduce you to Angelica, and she is the laser technician here at Visage Clinic, and you're also basically the person you want to come to for everything to do with skincare.
You got it. I've been doing this for 10 years, so everything from lasers, chemical peels, skincare, you name it.
Very cool. So what are we going to do on my face today?
Today we're going to be working with Forlay. It's a wonderful Japanese line. The creator of it actually is a Nobel Prize winner for his creation of the technology. We're working with some really fantastic ingredients. We have hyaluronic acid, we have powdered pearl, we have platinum, chlorella, so it's a multivitamin for your skin, basically.
Awesome. So for those of you who were watching and are like, I'm kind of interested, I'd love to get some more youthful, some more hydrated skin, but I'm not ready for injections or surgery, this is a great option.
Absolutely. It's a great place to start off, whether you're coming to see myself or whether you're going to see Dr. DuPéré. Everyone has skin, so everyone has to look after their skin. And even if it's just something like getting yourself on some really good skincare and sunscreen, we want to look like you, just the fresher, brighter version of you.
Nope, that's okay. Yeah. So you use this whole line?
I mix between this and Skin Medica. I actually had bad skin as a teenager, which is why I went to school for this.
Okay.
So I am super, super into skin in a very real way.
So this is cleanser?
So this is cleansing. And this is using a 4-lay line, so you don't have to do the fancy brush stuff at home. But for here, it's nice to treat people. I find the key is absolutely being regular, sunscreen every single day, and just finding what works for you.
Stick around, there's more to come.
Thank you for watching My City. I'm Blake Carter, and I am about to be spoiled by Angelica. And if you would love to come and see her and have the treatment that I'm going to be having done, or visit Dr. Marc for any of the other procedures they offer here at Visage Clinic, we are posting all of their information just right below, so you can get a hold of them really easy. And you can listen to me weekdays, Monday to Friday, 3 to 7 on the Blake and Wild Show on Kiss 92.5. Thanks for watching. I will see you again soon.